And questions are pouring in over the first drug approved by the FDA to treat COVID-19 patients. This news comes as Governor Whitmer is sounding the alarm about rising cases in Michigan. In just a moment, our chief health editor, Dr. Partha Nandi, will be joining us with some more answers about this. But first, here's what we know so far about Remdesivir. It is the first FDA-approved drug to treat COVID-19. It is sold under the brand name Veklury, and it's only advised for COVID-19 patients who are 12 and older. So we bring in Dr. Partha Nandi now. We really appreciate you being with us this morning, Dr. Nandi, to give us a deeper dive into this news. Now, we know this is one of the same drugs used to treat President Trump when he recently tested positive for COVID-19. And Remdesivir was previously only approved for emergency use in COVID-19 patients. What changed?
Yeah, good morning. This is a really good news for anybody who's looking for treatments, right, for COVID-19. But I think it's going to be really controversial. And here's why. I talked about this on 7 about, I think, 3 days ago, is that there's a big study from the World Health Organization which showed no change, right? No change in mortality, no change in hospitalizations. Really, it was a negative study. 2,750 patients, 405 hospitals, 30 countries. So I think there are people saying, wait a minute. We just saw this negative study. Why was it approved? And here's why it was approved. The study from the World Health Organization was not peer-reviewed, meaning that it was not in a journal, and people who are scientifically based didn't look at all the information. But Remdesivir's drug manufacturer talked about Gilead, and the FDA looked at that. They had 3 trials, one double-blinded placebo-controlled trial they thought was a better trial, and that's why they approved it. Remember, as you talked about, only previously was an emergency use authorization, which means you had to really be sick, people in the hospital who are seriously ill. Now, if you're anybody over the age of 12 and over 88 pounds, you can use it, and you can use it in the hospital. And you may have alluded to this, but since October 1, now hospitals can get it directly from the distributor, from the drug manufacturer. Before that, the government controlled where the drug went to throughout the country.
Okay, so for people who have loved ones who are battling COVID-19 right now, they're like, okay, we want to know, is this readily available, and can patients expect any possible side effects from it?
100%. Any drug that you get, you have to know that there could be side effects, and this is no exception. You can have, the most common ones are nausea and something called liver function test elevation. So liver function test elevation could mean that you have liver damage. Your doctor has to look at that. The other part is called hypersensitivity or allergic reactions, and that could be an allergic reaction to the drug, and you can have multiple symptoms from that. So you have to look at that. Is it readily available? Absolutely. Since October 1, it's now available from the drug distributor, and the government is not distributing it. So it's good news. Hospitals can get it readily.
Well, it's another tool in trying to fight this virus. Not a vaccine, not a cure, but it's something that hopefully will give some people hope. Thank you, Dr. Nandi, for joining us this morning and explaining all about Remdesivir.
My pleasure.